Okay, so chapter 33 is cancer, immune system, and skin disorders. So cancer is this abnormal growth of cells. And when it gets together and it grows to a point, it's called a tumor. And tumors can be benign or malignant. Benign means they're non-cancerous. They don't spread to other parts of the body, and they usually don't grow back when they're removed. Malignant, on the other hand, means it is cancerous. And these type of tumors will invade and destroy nearby tissue because they just continue to grow and grow. And eventually, they can spread to other parts of the body, and they sometimes do grow back after removal. And then metastasis is the spread of cancer to other body parts. Now, common sites for cancer are the skin, the lungs, colon, and when I say lungs, it includes the bronchi, the colon and the rectum, breast, prostate, uterus, ovary, urinary bladder, kidney, mouth and pharynx, pancreas, and the thyroid gland. And cancer is the second leading cause of death in the United States. So some risk factors, if I can get this thing to go forward. Okay, so the risk factors include growing odor, tobacco use, sunlight, ionizing radiation, um, certain chemicals, some viruses and bacteria, certain hormones like estrogen, family history of cancer, alcoholism, and then poor diet or lack of physical activity and being overweight. So most cancers do occur in persons greater than 65 years of age. Tobacco, whether it's smoked or chewed, can all be avoided basically because it's a preventable. Uh, and let's see, anything else that's really. Oh, alcoholism, the risk for certain cancer increase with more than 2 drinks a day. Okay. So that's kind of the risk. The treatments, if detected early, cancer can be usually treated or controlled. And the treatment will depend on what type of tumor it is, where it's at, that's the site, and the size of it, and if it has spread or metastasized. Some common treatments will include surgery, radiation, chemotherapy, hormone therapy, um, and biological therapy. It's known as immunotherapy, and radiation therapy is known as radiotherapy. So, um, cancer treatments, um, depending on the type of treatment it is, sometimes it damages healthy cells and tissues as well as gets rid of the bad cells too. So, depending on that type. So, cancer treatments are getting pretty sophisticated, better, but sometimes when they do go through these treatments, guys, sometimes you think the treatment is as bad as the disease, and it is. But it's necessary, and it's really all up to the person. But the side effects that comes with chemotherapy or with radiation therapy can be um, can be quite a challenge to deal with. Surgery as well. Surgery can be very disfiguring. So a person can have self-esteem and body image problems because this is affected. Radiation therapy, depending on the part that's treated, but they get burns because radiation burns, and they can have skin breakdown and even hair loss. Chemotherapy, depending on the drug that's used, they can have stomatitis, and this is just a fancy name for having mouth sores. Okay, well, if you in chemotherapy, it's so important for them to have good nutrition. Well, if you get sores in your mouth, guess what? You're not going to be eating. It hurts too much. So anything, the body is interdependent. So what affects one thing is eventually going to affect all systems. Hormone therapy, as you know, affects fertility in men and women, but men can also experience impotence if they're on hormone therapy, and as well as a loss of sexual desire or libido. So side effects of biological therapy, because it deals with your immune system. They can get flu-like symptoms. They can have bleeding and bruising, swelling, and skin rashes. And most biological always puts you at a risk for increased infect for puts you at increased risk for infection. So it's no fun. I mean, these people are really sick and they take a lot of care. Um, the person themselves have a lot of needs. They may have pain, so then they would need pain relief or control. They need lots of rest, but they need some exercise as well, because remember, we need exercise to keep our muscles and our strength up. Fluids and nutrition are just vital for a person who has cancer, preventing skin breakdown, preventing bowel problems like constipation, because a lot of the pain drugs are notorious. They are horrible at causing constipation. Diarrhea with some cancer treatments, so they have the opposite problem, or dealing just with the side effects from the medicines. And that can affect your memory, your hair, your skin. It affects so many things. Psychological and social needs, spiritual needs, as well as sexual needs. Um, the person that they are going through this very traumatic event in their life, and they can feel unwhole, they can feel unattractive, they can feel unclean. So they need a lot of support, not only from their family, but from us as well. So don't avoid a person because you're uncomfortable. If you feel uncomfortable about people with cancer, cancer is not contagious. um, Use touch appropriately. And you have to be aware of the person's cultural, because some people don't want to be touched. And just listening to them shows that you care. And sometimes they just need an ear to bend. Spiritual needs again are very important. And then persons dying of cancer often receive hospice care, which we'll deal a little bit more with that when we get to the end of life chapter, which is like chapter 44. So, with our immune system disorders, of course, the immune system is what protects our body from microbes, cancer cells, and any really harmful substance. And it's our defense. It's our defense against any threats from the inside or outside the body. So, any type of immune system disorder occurs when that occurs from problems with the immune response. The response either may be inappropriate or too strong or not enough or lack is known as lacking. So, like, here's an example. Allergies are an example of an exaggerated immune response. It's too strong to this antigen, and the antigen is what causes um, the response. Okay, so a bee sting, the sting, the venom from the bee is the antigen. Okay, so allergies are an example of this exaggerated immune response or reactions to substances that are generally not harmful. Autoimmune disorders are a little different in that the immune system actually attacks the body's own normal cells or tissues or organs. And there are quite a few of autoimmune disorders. But Graves' disease is pretty common. It's the most common form of hyperthyroidism, which means your thyroid goes on the rampage and increases your metabolism and does all kinds of crazy things. Um, Lupus is another form of autoimmune disease, and it's an inflammatory disease that affects the blood cells, the joints, the skin, the kidneys, the lungs, the heart, or the brain. Multiple sclerosis. This is a degenerative muscular disorder, but it's an autoimmune disorder. Rheumatoid arthritis is a type of arthritis that's caused from the body attacking the synovial fluid in your joints. And then type 1 diabetes is considered an autoimmune disorder, which in type 1 diabetes, the body does not create or have beta cells, which is way more than you have to know, but just to let you know. Okay. Um, let's see if there's anything else. So signs and symptoms of an autoimmune disease vary. It depends on what's being affected, but commonly fatigue, dizziness, not feeling well, and fever are common. Um, Autoimmune disorders are considered chronic, um, and treatment depends on the disorder and the tissue or the organ that is affected. So the treatment basically overall and in general is aimed at reducing the symptoms, controlling the autoimmune response, and maintaining the body's ability to fight disease. Mhm. So acquired immunodeficiency syndrome is known as AIDS. AIDS is caused by the HIV virus, or the human immunodeficiency virus. This virus is spread through the body fluids via blood, semen, vaginal secretions, and breast milk. It can be transmitted mainly by unprotected anal, vaginal, or oral sex with an infected person, needle and syringe sharing, HIV-infected mothers before or during childbirth, and then through breastfeeding for the moms. So whenever you're dealing with we deal with everyone. We think of it as we think of everyone has HIV. Therefore, you would use your standard precautions for everyone, and that's only so that you protect yourself and you're also protecting that person. So HIV, remember, is not spread by saliva, it's not spread by tears, it's not spread by sweat or sneezing or coughing or insects or any type of casual contact. But if you are dealing with these other areas like the perineal area or something that's bleeding, then you should be wearing those standard precaution PPE. The virus enters the bloodstream through the rectum, the vagina, the penis, the mouth, or the skin breaks. So once it enters the bloodstream, it can come into oh shoot. What did I want to say? Once it gets into it affects our immune cells known as T cells. T cells are really important because they are the cells that make cells kill the bad guys. So if you don't have anybody that kills the bad guys, the police, basically, then you're in big trouble. Okay? Um, and needle sticks. Needle sticks pose a threat to the healthcare team. So nurses, all healthcare team members should be aware that you should always be on the hunt for something that's sharp because let's face it, even though long-term care facilities are considered low risk, you still can be stuck. I mean, maybe a nurse unfortunately did not throw or did not follow proper protocol when she gave someone a shot and the needle's laying there on the overbed table, or it fell in the bed and with an open needle, or a lancet that they would use for a glucometer check. So there are ways. Um, so you have to be on the lookout. But the one nice thing about this is HIV is a fragile virus. So it can't live outside the body. It's not spread by casual contact. It's not transmitted by food, even if the food is prepared by an infected person. Some HIV infected persons have symptoms within a few months. Others can be symptom free for more than 10 years. However, they carry that virus and they can spread it to others, even though they show no symptoms. Okay, so persons with AIDS are when the HIV virus has continued to develop and develop in the person's immune system and it's not eradicated, but it hasn't been controlled. And it continues to build. And once those T cells get down to a certain level, they're depleted, or the virus is killing them off, basically. Um, then they go into AIDS. Okay, but the person with AIDS can develop other health problems because the immune system is damaged. So they're always at real high risk. Okay. Um, Again, there's no cure for AIDS. Um, and there's no way we can, um, as of yet, there's no cure. But we do have drugs that can help. The person with AIDS, though, is at risk for pneumonia, and most of them die from this pneumonia, from a specific type of pneumonia. They're also at risk for tuberculosis, Kaposi's sarcoma, which is a type of cancer, and then just nervous system damage. A lot of new drugs, like I said, have come out. They slow the spread of HIV in the body. They can reduce the complications, and basically they prolong the person's life. You may care for a person with AIDS or those with who are HIV carriers. Sometimes we know, and sometimes we don't. But we always treat people this. You should always treat each person the same. Whether they have AIDS or that you know about or not. And of course, this is extremely HIPAA confidential. So overall, you just assume that somebody has something and protect yourself and others from the virus by following the standard precautions and the bloodborne pathogen standard. That's the big thing here. Um, Trying to think about, make sure I've told you everything. If the person could have acquired um, HIV through a blood transfusion if they received one between 1978 and 1985. That was, I believe, back in the 80s is when the HIV really came into our awareness and on the radar. And we started and to know that it could be transmitted through blood transfusion and through blood products. So they've done a lot of work to keep that out, to test everybody's the transfusions for HIV. And also, aging in some diseases can actually mask signs and symptoms of AIDS. So older persons are basically less likely to be tested for HIV or AIDS. Now, I think we're out of that and on to skin disorders. So shingles. Now, listen, I do have quite a few long-term care persons who do get shingles, which is a herpes zoster virus, and it's the same virus that causes chickenpox. Okay, so the virus can lie dormant in nerve tissue, and then it becomes active years later. The most common in persons over 50 years of age. So that's why now that we have the vaccine, after you reach that 50-year-old mark, they encourage you to get the shingles vaccine. So persons are at risk are anyone who's had chickenpox and those with weakened immune systems. And what happens is they get this rash and or blisters start to occur on the skin, and it will follow the line of a nerve. Okay, it is a painful thing because it's on the nerve. Remember, it's dormant in the nerve tissue. Then when it becomes active, well, guess what's affected? The nerve tissue, and it hurts. And so pain levels do vary, but itching is a common complaint. Um, we can use antiviral drugs, and pain relief drugs are then ordered by the doctor. Shingles is also, um, oops. Um, so the first sign of shingles, the person just might complain of a little burning or tingling pain, or might feel numb, or it might itch a little in an area on one side of the body or on one side of the face, just wherever it happens to show up at. But after a phase or a week or weeks, this rash is going to start to appear, and then you start to get the fluid-filled blisters. And for most, if the person is healthy, blisters and heal, and the pain is gone in 3 to 5 weeks. But sometimes it takes longer, and that's really all you gotta have to know about the shingles. But just be considerate, be conscious of is what I want you to was what I want to say, so that you're aware of the signs and symptoms. And your book lists that for you as well. So, of Quality of life, again, you can read over that, but basically we're trying to protect not only ourselves, but persons transmitting anything that would be detrimental to another person. So this ends chapter 33, and I will talk to you soon.